Hello and welcome to Wellness Diaries on Top Joyful Talks TV. This is what we do every Sunday. Last week, we talked about breast cancer awareness. We carry Mr. Samuel Olayemi come on Top Joyful Talks TV. Come talk about the awareness being organized by Sunu Health Nigeria. We talked about so much last week. If you never subscribe to my channel, please subscribe to Joyful Talks TV, where you will see the link being displayed there so that you can register for free mammogram. Sunu Nigeria has given about 150 women opportunity to register for their free mammogram. The exercise is starting on Monday, which is tomorrow. So if you have not registered, kindly click to my channel and register. The link is there. So register for the free mammogram. Say plenty when it comes to health is a whole lot of money. So this time around you are going to do your mammogram and your breast screening free of charge. So please go to my channel and click on that link and register. So we're still in the month of October, and we're still talking about breast cancer awareness. About 42,170 women, according to National Breast Cancer Foundation. Na dem come out with this statistics talk say about 42,170 women will kpai. You know wetin that one mean? They go at the end of 2025. So as I see that statistics and that report, I was really, really worried, and na im make me carry another ogbonge guest come today on top Wellness Diary. Make we talk about this breast cancer thing. A lot of women don't really know what it is, and a lot of women don't pay attention to their body. They wait until it is too late before they can act. Na im make me carry Dr. Olajumoke uh Olajumoke Michael come on top Joyful Talks TV today. Olajumoke Grace is consultant, obstetrician, and gynecologist. He come this Joyful Talks TV. So let us welcome Dr. Olajumoke. Doctor, good evening. How are you doing? There is a little background noise, so maybe you just check your device to see how you can, adjust so that we don't have um, so much noise at the background. Can you hear me, ma?
Thank you very much. Yes, I can hear you.
Good.
I can hear you
All right.
clearly.
All right.
Thank you for inviting me for this program.
Thank you for coming. So how has your week been? How are you doing?
Very well, thank you. It's
You're
been
welcome.
eventful,
Bele.
but
You're
at least
welcome. You're welcome. So make we not waste
thank
plenty
you.
time. Make we not waste plenty time on top this particular topic because it's really, really scary. I don't see plenty women, a lot of them that are survivors, a lot of them that are going through breast cancer or any other cancer at, a lot of them. It's not a story, to be joyful about. It's something that is very, very worrisome. So now make me carry you come today. So make you tell us a bit about breast cancer. So wetin be breast cancer and how e take dey develop for woman body?
Thank you, Mrs. Joy. Now, one of the cancer which is very common for our environment. And according to the study where they carry out, they thought say na im be the one of the cause of death due to cancer for our women for Nigeria, not just Nigeria, for the whole world. So it's something where they give us concern because the deaths from this disease now something where we say they give most people concern. How this breast cancer na just growth wey person dey see for breast, and the thing wey dey cause am it na many combination of many things. But the main thing wey dey happen be say people wey get the risk for this condition, then e go lead to the normally cell suppose to grow. After e reach one stage, e go stop. But for cancer, breast cancer, wetin dey happen say the cell, instead make e grow, reach one stage stop, e go just dey grow without control, without any control at all. So as the growth dey occur, na so breast cancer go come happen. Thank you.
This one dey very scary o. So if you come your body, e go just dey grow dey go, e no get any stop, you no dey hear stop, e just dey grow for inside your body. So e mean say e fit transfer from one breast enter the second one.
Yes, e fit happen if dem no quick detect am and begin to treat am. E fit spread not just to the other breast o, e fit spread to other parts of the body like the lung, the liver, the brain. So na and even bone sef if dem no quick catch am and treat am.
Okay, so what are the most common risk factors? Because I remember a few weeks ago I was having some kind of pains on my breast and I had to go to the hospital make I do small breast examination. And after the breast examination, the matron was, asking few questions. She was like, do you have any cancer history in your family? So I want to know how this thing take dey relate together. What are the risk factor? And e dey come from person lineage, maybe your mama or your aunty or your sister don get cancer before for your family. E mean say you too or your children fit get am. Make you explain this particular topic because plenty people still dey confused how that thing take dey work.
Thank you, Sister Joy. Dis cancer, the things wey fit cause am, e dey plenty. As you talk, you don already mention some of them. For some people, e dey their family, especially people wey be say maybe their mother or their sister don get breast cancer before. Then people wey be say dem don get breast cancer before for one breast, dem treat am, the thing go, dem still dey at risk to get another one. Then also e get some genetics gene wey dey person body wey be say e dey lineage, wey be say if you pass am from one generation to another, the person dey at the risk of getting breast cancer. We dey call those gene BRCA1, that's BRCA, BRCA1 and BRCA2 gene. So people wey get this gene for their body, then they actually dey at high risk of getting breast cancer. Then also we don find am say women dey get am pass men. No be say men too no dey get o, but women dey get am pass men. Then also age, as we dey advance for age, like people wey don reach 40, 50, 60, dem don find out say dem the risk dey high as dem dey go that age. Then also e get some hormone, get one hormone wey we call estrogen. This hormone dey very very important. If the thing dey too much for body, for inside blood, e fit actually cause the risk of breast cancer. So this hormone estrogen dey find people wey begin menstruation early for life, or people wey be say dem e tey before dem reach menopause. Menopause usually by 50, 51, some people suppose don reach menopause, but people wey be say dey tey pass that 50, 51, dem dey at risk because that estrogen, that hormone go dey their body for a long time. People wey be say before dem get their first pikin, their age don advance, maybe because of career, then their first pregnancy, dem don already reach 40, dem also dey at risk of breast cancer. Then there's people wey be say dem dey take some hormones, that estrogen, dem dey use am treat some things, maybe for family planning, or dem don reach menopause, dem come dey use estrogen, dey call am hormonal replacement therapy, HRT. So people wey dey take this hormone too, dem dey at little risk of getting breast cancer. Then when we come down again to lifestyle, e get some lifestyle wey be say we go dey do every day wey fit cause us this risk of breast cancer. If we just dey sit down, we no dey do any activity too much, physical activity, no exercise, we just dey chop fatty food, saturated fat, you come become obese, big fat, you dey at risk of breast cancer. Then if you dey take alcohol excessively, too much of alcohol consumption, you also dey at risk of breast cancer. So na the things wey fit increase the risk of person to get breast cancer na im be all those things wey I don mention.
Thank you so much, doctor. As we dey talk, you mention say man man fit get breast cancer too. So how man no get breast now, so how man wan take get breast cancer like women, and how does it work?
Dat one too na almost the same method wey woman dey take get am na im man too dey take get am. Dat one e dey rare, e no common like woman. Shey you understand? But e no mean say e no fit happen for man. At least if we carry 200 man go check dem now, you fit see say maybe only one out of dat 200 fit go get am.
Yes.
So as I don talk now say things wey dey cause am, if e dey family, if you get the gene, shey you get, if lifestyle too, that obesity, fatness, too much of fatty food, shey you understand, inactivity, physically you are not active at all, then you dey consume alcohol too much, all those things fit also increase that risk for the man.
So how common is this breast cancer for Nigeria? I know say according to statistics dey say na im be the most common leading cause of death among women. So how e be for Nigeria now?
um
You know, from your
for
job, what's the, is it rising or is falling, the rate at which women dey come hospital for breast screening and for breast cancer at the end of the day?
thank you for that question. We notice say the rate wey breast cancer dey take happen now don dey increase. E don dey increase, maybe because of our lifestyle now. You know say western diet wey we dey chop, e dey on the increase. So then inactivity, most people na, you know, they will say work from home, inactivity, shey you get, all those things dey on the increase. So the thing too go increase breast cancer. Then also because people now don dey aware, dem dey check their body. Unlike before wey be say even if person get am, you no go know say na him get, because no awareness. But now people don dey aware, so dem dey go hospital. So the rate too, reported rate, e go also dey high. So for Nigeria at the moment, you know, we no dey keep better record, but the one wey we get for hand, e show say if 100,000 people now dey get cancer, say na about 52% of them out of that 100,000 go die from that breast cancer. Then also if you carry 12 women, say you wan screen them, do test to know whether you get breast cancer, e don start, they don do research say out of that 12, maybe one go show, dem go detect say im get breast cancer. So na the statistics wey dey for ground be that now.
So e mean say the case is still on the rise. So e mean say
E don dey rise.
e still, people are still coming down with breast cancer. Okay, make we ask again, what are the early warning signs that women should not ignore? You know say for this part of the world, we no dey take our health serious, especially women. Our own na to make husband dey okay, make children dey okay, make our in-laws dey okay, but we ourselves, we no dey pay attention to our body. We fit dey get headache now, we go just, you know, wave am go one side, think say after sometimes e go come down. So wetin be the warning signs that women should not ignore as regards to breast cancer or breast examination?
Okay, for breast cancer, the warning sign, the thing dey give sign, but you need to know your body well well before you go fit recognize those signs.
Okay.
That's why we dey tell women say make dem dey check their breast every month after their menses, so that if those changes begin happen, they go quick notice am. So the first thing wey dem fit notice na the skin around the breast. You know as the skin of orange dey be,
Mm.
once you notice say your skin around you wey dey cover your breast dey
Mm.
look like the peel of orange, we dey call am peel d'orange, na French word, skin of orange. Once you see say e dey look like that, you begin dey suspect. Or your nipple wey be say e dey stand before, e begin to dey point downwards, dey make you dey very very suspicious. Then if you check, you touch your breast, the place wey be say before you no dey feel any lump or any thickness, you begin feel lump or thickness for there, make you begin dey suspect. Then another one be say if your nipple begin discharge blood, then you need to be very very you need to take all the necessary steps to get yourself examined by a health practitioner. So na the sign, na the warning sign be that.
So how often, should women, perform this self-examination? How often should we perform this self-examination? And wetin be the correct way? Because a lot of women, if you ask me now, I no sabi. I no sabi perform. I don try am, but I no sabi perform am. So how women go take, how you go fit teach? I know say we no fit pull our cloth and begin do all those breast examination, but you fit tell us how a woman should perform this. You don tell us say na once you finish your menstrual cycle every month. So how woman go fit take do this self examination by herself, and how often should it be?
Okay. I wish say I fit play the video,
Mm.
but I no know whether permission dey for that one, but I go
We
try to explain sha.
no wahala. We
So
fit put the video later.
later
Mm.
so the advice be say woman wey dey menstruate, wey don begin menstruate,
Mm.
every month you go, after you finish your menstruation, immediately you finish, because around that time the breast, around that time, you know say if you dey menstruate, before menstruation and when you dey menstruate, breast dey heavy.
Yes.
So when you don finish menstruation, you go believe say that heaviness don reduce, so the tissue wey don swell up before go reduce, so you go fit check whether anything dey there well
There.
well pass when the thing dey swell up or dey tender. So you go stay in front of mirror, you go put your hand for your side, you go remove your cloth to expose the breast, put your hand for your side, dey in front of mirror, you go come chest tap so that the breast go show well well. Then you go come look the skin around that breast, check the skin well well whether that orange peel appearance wey I talk before, whether you go see am. Then you go check the nipple too to see whether the thing dey point up or abi dey point downward, or you see any
Discharge.
ulcer, maybe wound or discharge. That one you go press. After you check, now you go come put one hand for back of your head. Maybe for now, if you wan check the right, you go put the right hand for the back of your neck. Use the left hand, the palm,
Mm.
you go use am gently, you go touch the breast from up outward, you go round, you dey check for any mass,
Mm.
any lump, or that anything discharge come out. You go repeat the same thing for the other breast. So now you suppose do am. You fit lie down sef, check too, check the armpit whether you go see any swelling or any pain for that place. So you suppose do this every month after. Then for people wey dey don already stop menstruation, because you see na that time sef fit happen pass. Those ones too, wetin you still fit do your breast self examination every month. But the thing be say, since you don stop menstruation, you no fit use that one as a guide.
Okay.
So wetin you go do be say, you go choose one day for the month. So one day, and then that day you go dey follow every month. Maybe for example, now if you choose say na 2nd of
October now.
every month, exactly, you go dey do am every month the same time. You go still the same way wey I describe am, na you go still check.
Thank you so much, Dr. Olajumoke. Make I ask again o. You know say as women, as we dey take care of our body, watch this show, know what we should do to our body, I don hear plenty things say if a woman dey less than 40, e no go fit do mammogram. For instance, na person check herself now, feel say e get lump when e notice, and e go further say make e go hospital go do maybe screening or mammogram. At what point, at what age person fit? I don hear say if you never reach 40, make you no near the machine o, say you no fit do mammogram. Abeg make you throw more light on this particular one.
Thank you. The thing be say e get some guidelines wey be say concerning screening, dem go discuss say mammogram make you start to do am as from 40 years. But dis thing no be the rule no be say you must be 100%. E get some places wey be say you fit do dat mammogram before 40 years. People from 35 years fit
Okay.
do am, especially if they don get the family history. Like I mentioned before, if maybe their mom, their mama, their sister don get breast cancer before, or if the gene wey I mention, that BRCA1 gene mutation, BRCA1 BRCA2 gene, if dem get am for their family, that's the hereditary one, those ones na very high risk. So those people, as from 35, dem say make dem dey do mammogram every year or every 2 years
Okay.
to detect am. Or person wey don get breast cancer before, e don treat am, e don go, that one you know na, even if you never reach 40, you go dey do that mammogram every year. So na, but the routine be say person no dey at risk, or the risk dey low for breast cancer, and as from 40 years, if you dey do am, you fit dey do the mammogram.
Okay, because I know say 2 years ago, abi last year, I do mammogram, and when I come begin notice some kind small small pain for my breast, some people say don do mammogram again o, because you don do am last year. So e mean say e still safe for somebody to do mammogram every year.
Yes, e dey safe every year, every 2 2 years, for low risk. Even some people wey get that high risk, wey be say they dey very at high risk, dem even talk say make dem dey do am twice a year,
Okay.
every 6 months.
Okay, thank you so much, Dr. Olajumoke. So this is Joyful Talks. You are watching Wellness Diaries on top Joyful Talks TV. We don dey talk plenty things about breast cancer. If na now you dey join us, you don miss plenty things, but you fit catch up sha. Now, we are talking about breast cancer. Since we are still in the month of October, I really want us to talk about this cancer of a thing, breast cancer, so that a lot of women go know wetin dey suppose do, especially when dem don dey get small small sign. My guest today na Dr. Olajumoke Michael. Na im dey on top Joyful Talk TV today. Dey talk plenty things, dey pieces plenty myths wey a lot of women no know before. So make we go on with the conversation. Doctor, I wan ask, what are the major treatment options available for breast cancer today? A lot of people go feel say once you get breast cancer, your own don finish, there's no remedy, you no get cure. Wetin be the treatment, wetin be the treatment wey person wey get breast cancer fit undergo? And I wan know whether e get cure, because sometimes fear sef dey kill a lot of women wey don dey diagnosed with this breast cancer. Once they hear say they get breast cancer, they don fear go dey play so much role in their body. They no dey fit, they get courage to fight on. So wetin be the treatment plan? And the breast cancer wey we dey talk about, e get cure abi e no get?
Thank you. Breast cancer, if it depend on the stage, you know say different stage dey. E get the early stage, e get the advanced stage. That early stage mean say e just start, e never begin spread. But by the time wey e begin spread, e don become advanced. That if e spread go to the next breast, e fit go to other tissue around that place or even far places from the body. So now e depend on the stage wey you catch am. If you catch am early before e begin spread, you actually fit treat am completely wey be say everything go comot am. But if e don already spread, e dey very difficult to treat. And unfortunately for our environment, most of our women, before dem go present, the thing go don spread. So that's why the death from breast cancer dey very high
Hi.
for dis our side. Exactly. So the treatment wey dey available, e fit be operation, that's surgery. So wetin dem go do be say if e never advance, maybe na just the swelling, the lump na im just dey there, dem go comot am. Den if na only the breast the thing still dey, dem fit comot the whole breast, we dey call am mastectomy. Den if e don dey advance, there are still some treatment wey dem fit use. You fit use chemotherapy, that means you go use medicine. Den you fit use radiotherapy, that one na the form of treatment wey be say dem go use, we dey call dem ionizing agents, dem go direct am for the breast. Den we fit use other treatment like hormone, if the depending on the type of the breast cancer, because breast cancer sef get subtype. So depending on the type, you fit even use hormone too fit treat am. Den e get some therapy wey we dey call target therapy. So those are the various options wey dey available. I no sure say na dis forum na im person go dey go in depth about all those
It
all
is
those
well.
treatment.
It is well. So as we don't talk about the stages now, so how many stages do we have? I know said they get stage one, stage two, stage three,
Stage 3
stage
and
four.
stage
They
4.
okay, they get stage
Yeah.
four. So now when you don't reach stage four, now it be the point of no
Dat
return.
one don very yes
Now
o.
only miracle fit do that one.
Na miracle, na miracle.
Okay, so you don hear am now. Doctor don tell you say the na early detection na im be the saviour for this cancer of a thing that we're talking about. E fit be breast cancer, e fit be any other cancer for your body, e fit be any other cancer, e fit be cervical cancer. As we dey talk about women now, e fit be cervical cancer. So e mean say if you detect am early, the survival your survival is high, you know, is very very high. So now make we talk about the this um treatment, the treatment option wey you don talk about now. Wetin be the side effect? Because I hear say once person get cancer, any cancer at all, and you use chemotherapy or radiotherapy, e dey reduce the lifespan of the person. In fact, the person go even kpai quick. How true is that? Make we know.
The treatment, especially chemotherapy and radiotherapy. Okay, for the one of surgery be say, you know say if you comot person breast, woman breast, e fit become dis thing go do, maybe the person go become self-conscious. And if na person wey don marry, e fit lose im self-confidence. Shey you understand? Because e
Yeah.
don comot breast. But thank God say now we get wetin we dey call prosthetic breast wey dem fit
Use.
put for that place.
Okay.
So that one na the one for surgery. Then for chemotherapy, then the complication wey fit occur too for the operation itself, e dey there, like blood loss. Blood fit lose blood wey be say go need make dem give the person blood.
Blood.
Shey you understand? Then pain too from the operation na another thing. So for chemotherapy and radiotherapy, we get the one wey be say na early complication, wey be say as you dey take am now, within days you fit begin to manifest. So we get you fit get call am nausea, that's the feeling say you wan vomit. Some people go dey vomit excessive. Then e get the one wey be say e go affect the skin of the whole body, wey be say the skin you see say e develop some reaction for body. Then some people go get ulcer for mouth.
So
For mouth. Then some
side
people,
effects.
yeah, immediate side effects. Then some people then go begin to pass water stool, wetin we dey call diarrhea.
Okay.
Then some people, their blood level, because all those chemotherapy and radiotherapy, the target be say dem wan kill the
The
cancer cell.
cancers.
You remember dey kill cancer cell, see dey just affect the normal cell of the body. So
Mm.
person fit develop low blood level, we dey call am anemia.
Hmm.
Shey you understand? Then hair loss, as in alopecia, I no know whether you don hear
Mm.
about their hair. That one sef dey very common. Hair go dey pull. Some people dem go even shave their hair
Hair.
because of the fact say the thing just dey pull comot anyhow. So dem go just shave the hair. Dem go know say at least nothing go dey pull comot again. So that one na the immediate or early complication. Then e get the one wey be say we dey call am late complication. Chemo e fit affect other parts of the body like the lung, the am I still on? I
Yes,
think
yes.
I
Yeah.
okay.
Mm.
Wetin we dey call am. Then weight loss e fit happen too.
Hello. Hello, doctor. Hello, doc.
Eh? Um
Okay.
yes, I don't know if I've lost connection or you are still with me.
Yeah, I think the network is trying to be funny. Okay, so before we leave you,
Okay.
I wanted us to talk about a bit about, you know, the kind of things that we eat, because I don't hear say if you get cancer of any type, make you run away from sugary things. You know, so you don't talk about the lifestyle and the kind of things that people dey chop. So wetin be the connection between sugar and cancer? How women fit run away from this kind food items to be able to preserve their lives?
The thing be say with breast cancer,
Mm.
like wetin I don mention before, the food wey dem don find out say e dey actually increase the risk, like na fatty food,
Okay.
like fried chips,
Mm.
cheese and burger and cheese.
Mm.
Shey you understand?
Mm.
Brown chicken, even this our suya wey we dey chop, dem talk say e actually increase the risk, especially that fatty part wey
Mm.
Yoruba dey call shey ora. I no know whether you understand Yoruba.
You know, say women we dey
So
like sweet things well well.
so na those things na im dem don find say if you chop am too
Too
much
much.
or you drink alcohol too much. But the one of sugar, I know say for this life, anything wey you take in excess, e no good, e no too
Mm.
good, get
So
side effect.
so so
So
moderation is key.
so exactly. So the advice wey dem give be say make person dey eat
Thank
balanced diet, lots of fruits, vegetables, then be
thank you so much.
physically active. Na the
Thank you.
advice.
Thank you. So before we let you go, are there some misconception about breast cancer that you want to debunk? Maybe plenty things when you don't hear about breast cancer. Me, I don't hear plenty things. So I don't hear say na attack. I don't hear say na witches and wizards they follow the woman come from village. I don't hear plenty things. So what are the misconception when you don't hear about breast cancer that you would like to clarify, tell women as it is, so that we no go dey find one mama grandmama in the village, make we know say na the way we take dey take care of our body na im dey cause am.
Uh, thank you. The misconception wey dey about breast cancer, e dey plenty.
Mm.
But I go take am one by one.
Okay.
The one wey dey common na I go the common ones na I go mention.
Mm.
So one of the common one be say na only woman na breast cancer. dey
they
affect.
catch.
So dat one na misconception, man sef fit get am. Den the second misconception be say na like you don talk am now, say spiritual attack.
Mm,
No be spiritual attack o, na combination of a lot of factors wey I don mention before. So
okay.
if you still remember all those factors wey I don mention before, if you fall for dat category, make you take your breast self-examination very very important.
Mm,
Den your mammogram, once you hit 40, if you no get the risk, once you hit 40 begin do am every year. Or if you get all those risk wey I don mention, family history,
mm,
gene, hereditary shey you get,
mm,
abeg as from 35 begin do your mammogram. Den the other myth be say na only western pipu, European as in western world
mm,
na im dey get breast cancer, no be our disease. Study don show say no be only western country na im the thing dey affect o,
mm,
e dey affect us well well. I get sister wey be say she never reach 30, she never reach 40, she die from breast cancer.
mm,
um So any no be western disease, e don e dey happen for here. So make we take am serious, make we no just brush am aside say no be our disease. So den the another dis thing be say okay, I think I don talk about sex, age,
mm,
culture,
mm.
diet. So na the different myths wey I remember na I
Thank,
wan
thank
mention.
you so much. Thank you. So we are wrapping up now. Make we know. I want make you give advice to somebody when they watch this program now. When be say in they go through breast cancer or any other cancer. You know, say people they stigma dey. People feel they run away from them. Ah, this one get cancer. Hey, please give them word of advice and also clarify, make you tell other people wey dey feel say cancer dey if I get am and I sit down close to you, you too go get am. Make you clarify that myth too, because a lot of people feel say when person get cancer and you sit down close to the person wey get cancer, you sef don carry am. Abeg, help us encourage people that are going through a lot at this time, you know, people that are going through breast cancer or any other cancer.
Thank you. So as you talk am, pipu dey fear say if dem sit beside person wey get breast cancer dem fit get am. But breast cancer no be one of those disease wey be say you fit catch by just
Sitting close to the
getting
person.
by sitting or having contact with the person, whether sexual or non-sexual. It is a non-communicable disease.
Disease.
Non-communicable means that you can't pass it from one person
Person to
to
another.
the other if you have it. So make we no dey run from them or stigmatize them. Instead, make we show them love. People wey get breast cancer or any cancer for that matter, they are going through a lot, both financially, emotionally, psychologically. So they are going through a lot. Some of them have anxiety disorder, depression because of this. So what they need from us, and also from their relatives and their loved ones, is support. The support is not just monetary support
Support.
alone. You should offer them comfort, offer them support both psychologically and emotionally. So that will be my advice to the general populace. Say if you see person wey get cancer, abeg no run from am. Instead, make you support am in any way wey you fit do. Den for people wey get cancer, no matter the stage, abeg no, I know say e no easy, but no isolate yourself, no keep to yourself. Seek out support. E get some group wey be say dem dey offer support to women wey get breast cancer. So all those group, maybe after dis program I fit share dem with you, so that if anybody reach out, we fit direct dem to those support group wey go offer dem e fit no be money o shey you get, but at least the fact say dem go give dem support psychologically, emotionally. Den other survivors of breast cancer too wey dey the group, dem go fit also rally around dem and support dem.
Oh, thank you
Thank
so
you.
much. Thank you, Dr. Grace Olajumoke Michael. The is a consultant and obstetrician and a gynecologist. Thank you so much for coming on Wellness Diaries today. You don't hear now, as a woman, you know say you don't toy, you don't suffer with that man. You don't do plenty sacrifice. Don't let another woman come and enjoy what you have labored for. Take care of your body. If you dey feel somehow, e no take you so much to go hospital, go check, make you know wetin dey do you. Check your body. No just wave am or push am go one side and say don't worry, God will take control. Say for this part of the world we believe so much in prayer. Me too, I believe in prayer, but e get some kind things wey e be say you too you go do for yourself. God don give us the authority, and God don give us the for us to take care of our body, for us to take charge of our life. So that is the will of God for us, the plan of God for us. He want make we dey healthy, make we even serve am as we dey alive. So no just push aside all the signs wey you dey get, all the warning signs wey you dey get. No push am aside, go hospital make you know wetin dey do you. Thank you so much, Dr. Olajumoke. If you never subscribe to my channel, kindly subscribe to Joyful Talks TV. For that place you go see where you will click on a link that has been there. That link na from Sunu, Nigeria. Click on that link, register for free mammogram. Register for free mammogram. If you no get money, no say after I no get money, now free mammogram don come, make you register. You also fit put your comment for there. You fit put your testimony for there. If you be survivor, maybe you don battle breast cancer and you don win, you fit put am for there so that you go encourage a lot of people. Tell them say make they no fear, say they go overcome. Thank you so much, doctor, for coming on our show today. Till next week, we'll talk about another
Anytime. Thank you for
interesting
inviting
topic. Till next week, we go see una next time. Thank you so much. Bye for now.
me. Thank you.
Jesus.